Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Immunotherapy for cancer treatment. Introduction. The immune system helps your body fight diseases and infections. Immunotherapy is a type of cancer treatment that boosts your body's immune system to kill cancer cells. There are several types of immunotherapy, and they work in different ways. The type of therapy that is right for you depends on what type of cancer you have and the other treatments that you receive. This program explains immunotherapy. It talks about why immunotherapy is done as well as the benefits and risks of the treatment. Cancer. The body is made up of small cells. Normal cells in the body grow and die in a controlled way. Sometimes cells keep dividing and growing in an uncontrolled way. This causes an abnormal growth called a tumor. If the tumor does not invade nearby tissues and body parts, it is called a benign tumor. A benign tumor is a non-cancerous growth. Benign tumors are usually not life-threatening. If the tumor invades nearby tissues and body parts, it is called a malignant tumor or cancer. Cancer cells spread to different parts of the body through blood vessels and lymph channels. Lymph is a clear fluid that is made by the body. It drains waste from tissue. Lymph travels through special vessels called lymph nodes. Cancer that moves from one tissue to other body parts is known as metastatic cancer. Cancers in the body are given names depending on where the cancer started. Cancer that begins in the throat will always be called throat cancer, even if it spreads to other places in the body. Immunotherapy. Immunotherapy is a type of cancer treatment that boosts your body's immune system. Immunotherapy helps your body's immune system fight cancer cells. The treatments may help prevent the spread of cancer cells, slow down the growth of cancer cells, or directly kill cancer cells. There are several types of immunotherapy, and they work in different ways. The type of therapy that is right for you depends on what type of cancer you have and the other treatments that you receive. Let's review how your immune system normally works. The immune system is the body's natural defense system. It consists of cells, tissues, and organs that work to defend the body against harmful agents, such as bacteria, viruses, or foreign substances. The immune system protects you from disease and infection. The immune system attacks and destroys substances that it thinks are foreign. Foreign substances are different from the body's normal, healthy tissues. Immunotherapy helps your body's immune system respond to cancer cells. Immunotherapy can be given orally in pill form, intravenously through a needle inserted into a vein, subcutaneously through a needle inserted under the skin, into an organ such as a lymph node. There are several different kinds of immunotherapy. These include checkpoint inhibitors, colony-stimulating factors, cytokines, modified immune cells, vaccines, inactivated bacteria or viruses. Checkpoint inhibitors are drugs that activate your body's immune cells to help fight cancer. These drugs are manufactured antibodies. They stick to proteins that help the immune system fight cancer cells. Checkpoint inhibitors strengthen your immune system. Certain proteins, such as CTLA4, PD-1, and PD-L1, are important checkpoints in the immune system's response to cancer and are the targets of this class of drug. Some immune checkpoint inhibitors include pembrolizumab or Keytruda, nivolumab or Opdivo, atezolizumab or Tecentriq, ipilimumab or Yervoy. Colony-stimulating factors, or CSFs, are chemicals that can help your body increase the number of blood cells and the amount of bone marrow in your body. This increase in the number of red and white blood cells and platelets helps strengthen your immune system. Cytokines are chemicals that help cells in the immune system grow and fight foreign substances like cancer cells. They send signals to white blood cells and other cells that produce an inflammation reaction to help your body fight cancer cells. Cytokines are usually injected under the skin or into a muscle or vein. Common cytokines used to fight cancer include interleukins, interferons. Sometimes the body's own immune cells are modified and used to treat cancer. These cells are known as modified immune cells, and the approach is called adoptive cell transfer. CAR T-cell therapy is one example. Vaccines are treatments that can help prevent and fight infections or diseases. Vaccines take small amounts of inactive material from a disease that it is trying to fight. For example, a vaccine can use an inactive part of a virus to help activate the immune system to fight that specific illness. Some vaccines can be used to tell your immune system to fight cancer cells that are already in your body. BCG, or Bacillus calmette-guerin, is an immunotherapy that is used to treat bladder cancer. BCG uses bacteria that are placed in the bladder with a catheter. These bacteria trigger an immune response against cancer cells.
Telimagene laherparepvec, TVEC, is another type of immunotherapy used for melanoma.
A healthcare provider directly injects modified herpes viruses into cancer cells on your skin or into a lymph node near the skin. The injected treatment helps train your immune system to find and fight other cancer cells throughout your body. Scientists are working to create other viruses to treat melanoma and other types of cancer. These viruses do not cause infection because they have been modified in the lab to fight cancer and not cause illness. Other immunotherapy treatments are being developed in clinical trials. Clinical trials are studies that test new treatments. Talk to your healthcare provider to see if a clinical trial may be available for your type of cancer.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
How to prepare. Immunotherapy may not be right for all cancer patients. Some immunotherapy treatments are used in combination with other cancer treatments. Ask your healthcare provider if immunotherapy can help treat your cancer. Before you start immunotherapy, your healthcare provider will perform a physical exam. They will ask about your symptoms and health history. Ask your healthcare provider how to prepare for your cancer treatment. You will be asked to complete lab tests and possibly other studies prior to starting treatment. This helps ensure that immunotherapy is safe for you. Other questions you may want to ask your healthcare provider include: how often will you receive immunotherapy? What are the possible side effects? Will the treatment affect your daily activities? What clinical trials are available? How will your healthcare provider determine the effectiveness of the treatment? Tell your healthcare provider about any medications you may take. You may have to stop taking certain medications before you start immunotherapy. Risks and side effects. Immunotherapy may cause short or long-term side effects. Ask your healthcare provider about the possible side effects of your treatment. Tell your healthcare provider if side effects make it difficult to complete your normal activities. Side effects of immunotherapy may include flu-like symptoms such as a fever, chills, or weakness, itching, a rash, shortness of breath, cough. Other side effects of immunotherapy may include loose stools, abdominal pain, fatigue, hormonal changes such as inflammation of your thyroid gland, swelling or fluid accumulation. Other side effects of immunotherapy can include kidney failure, liver inflammation, pain or swelling in the muscles and joints, eye inflammation. Some side effects may be severe and require hospitalization. Some side effects may last beyond the end of treatment and may become long-term. Sometimes steroids or other immune-suppressive medications are needed to treat side effects of immunotherapy. They help reduce inflammation caused by immunotherapy. For some side effects of immunotherapy, it is important to start treatments such as steroids right away. Contact your healthcare provider as soon as possible to discuss new symptoms or side effects when you receive immunotherapy. Your healthcare provider can help you find options to treat your symptoms. Immunotherapy can also cause skin reactions where a needle was used. These may include itchy skin or a rash, pain or soreness, swelling and redness. Certain types of inflammation reactions due to immunotherapy may cause depression or suicidal thoughts. Call your healthcare provider, a counselor, or a crisis line right away if you have thoughts of hurting yourself or others. CSF's colony-stimulating factors may cause side effects that include bone pain and soreness, fatigue and weakness, fever, trouble eating. Other possible side effects of immunotherapy include changes in blood pressure, inflammation of heart tissue, problems with digestion, hair thinning due to hormonal changes.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Immunotherapy is a type of cancer treatment that boosts your body's immune system to fight cancer cells. The treatments may help prevent the spread of cancer cells, slow down the growth of cancer cells, or directly kill cancer cells. There are several types of immunotherapy, and they work in different ways. The type of therapy that is right for you depends on what type of cancer you have and the other treatments that you receive. There are several different kinds of immunotherapy. These include checkpoint inhibitors, colony-stimulating factors, cytokines, modified immune cells, vaccines, inactivated bacteria or viruses. Immunotherapy may not be right for all cancer patients. Some types of immunotherapy are used in combination with other cancer treatments. Ask your healthcare provider if immunotherapy can help treat your cancer. Immunotherapy may cause short or long-term side effects. Ask your healthcare provider about the possible side effects of your treatment. Tell your healthcare provider if the side effects make it hard to do your normal activities. Contact your healthcare provider as soon as possible to discuss new symptoms or side effects when you receive immunotherapy. Your healthcare provider can help you find options to treat your symptoms.
Thank you for using Explain.